we have a dysfunctional health care system in America. By any measure, dysfunctional.
Yeah.
We have 47 million Americans who don't have health care coverage. Health care premiums have gone up 90% in the last 6 years. Even if you've got coverage, you're worried about losing it. In many cases, mental health is not covered. Preventative care is not covered. Chronic care is not covered. Long-term care is not covered. And people are terrified because they're locked into their job. They can't change jobs because they're worried they may lose their health care coverage. They're worried, among other things, about the issues like pre-existing conditions. This has to change. I am proud of the fact that I am, as of this moment, the only candidate for president, Democratic or Republican, who's laid out a substantive, specific, truly universal health care plan. I hope someone will ask me about it because I can bore you to tears with it. But it is something I'm very proud of and I care deeply about.
I was going to ask about healthcare.
Okay. I'll be glad to. I was hoping someone would ask. Basically, my health care plan is a truly universal plan. Everybody in America will be covered. It's based on the idea of shared responsibility, which means employers have to cover their employees or pay into a fund. The government will set up health care markets around the country. And the way you visualize this, if you're a consumer, then what you'll be able to do is go into those markets and choose what kind of health care coverage you want and from whom. There'll be private insurers and the government will be there too. So for example, you could choose a Medicare single payer kind of health care plan. The gaps in our health care system are largely eliminated. There's total mental health parity. Mental health is treated exactly the same way as physical health.
That's awesome.
There is long-term care, basic dental is covered, eye care is covered. So the idea is to fill in some of these gaps that exist in our system today. And then there's efficiencies that are created that don't exist today. Because we spend 30 to 40 cents of every healthcare dollar on administrative costs. So we dramatically bring down administrative costs, mandate the use of technology, mandate the use of electronic record keeping. We subsidize the cost of health care. Low-income families are completely subsidized. As your income goes up, I see eyes starting to glaze over already. As your income goes up, the subsidy goes down. And on the issue that many of us have been concerned about, of job lock, which are people being stuck in their jobs because they're worried if they change jobs, they can't keep their coverage, or they have a pre-existing condition, some problem like that. There are no pre-existing conditions in this health care plan. They don't exist. If you have your health care in one of these markets, and you either get laid off or transferred, or you just decide to change jobs, you can take your health care coverage with you. So we want to talk about one last thing about this because it's the part that our leaders sometimes don't want to deal with. There is a cost associated with universal health care. It's going to bring down health care costs for everybody, and it's going to cover everybody who doesn't have coverage. Those are great things. But it's not free. It never would be. My plan costs $90 to $120 billion a year. I think it's worth it, and the way I pay for it is by getting rid of Bush's tax cuts for 50 million.